Our old friends of Health 2.0, Bob Kocher, also from Venrock by accident, and Owen Tripp, CEO of Grand Rounds. Thank you. All right. So in contrast to just sort of hanging out and chatting, which you guys obviously did do a while back, you're far beyond that. So, but I would like to start there. I believe, Bob, and tell me if I'm wrong, was Owen one of the first, before it was called Grand Rounds, was Owen one of the first companies you started with when you came from government to McKinsey to Silicon Valley? Was that right?
Exactly. So right after I got to California from DC, early on before I wanted to join Grand Rounds, it was called Consulting MD at that time, we had met as part of my getting to know people that are smart and interesting in California and had many good conversations. And then shortly after that, Owen said he's going to join a company called Consulting MD. And I said, awesome. We talked a lot more.
Is this when you started Reputation.com?
This was so I co-founded Reputation.com in 2006, and then I left in 2011, 12, and I started hanging out with the Venrock guys just generally, and Bob had just come aboard, and Bob and I were talking about this, and I've been obsessed with and interested with healthcare for a long time, and Bob was saying, I think this telehealth thing is going to be real. Can you help me think about what a product for telehealth would be? Ultimately, we didn't do that, but he was on that wave early, and it led to a bunch of really good conversations.
All right. Just in case anybody doesn't know who Grand Rounds is, give the 30-second description of what you guys do. We're not going to talk much about it, but just give the promo.
High-quality healthcare for everybody. We believe there is access to all the brains, all the science, all the technology. So we provide two sets of products. One for people who are dealing with really complex episodes through things like expert opinions, concierge office visits, and hospital treatment decision support. And the second called Summit, which is a clinical quality and navigation product. And we distribute both primarily through large employers, but not exclusively.
Right. And you've by now raised in total 125, I'm guessing here, you should know. One of you should know the answer. 125, is that right?
105.
Sorry, I gave you an extra 20.
You want that in Bitcoin or Ethereum?
I'll have the 20 back in Bitcoin, 2012 Bitcoin, please. That's fantastic. So tell me a bit about your relationship's evolution. I mean, it's now a long time, and I'm sure you get together and have intellectual chats, but at some point when there's that amount of money working, not all of it is Venrock's, but a bunch of others as well, there are these other pressures going on. So tell me a bit about how you work with each other, how you send off both sort of formally and informally.
So one of the really fun parts of our relationship is as a person who references being a doctor, I find myself often pushing Owen to make sure we focus on the thing that matters most, which in the big scheme of healthcare is having a doctor who is expert do the right thing to a patient. And because there's no amount of healthcare IT or services or social work that you can wrap around a clinician doing the wrong thing with a patient to make it better. And as somebody who had been a doctor at Harvard seeing patients and then discovering that his quality was in the 52nd percentile of doctors in Massachusetts, and then having the reaction all doctors have, which is, well, the data can't be right, and it was, I realized that even if you're working at a famous place, you may not be as awesome as you thought you were because you have no information. And that's manifests much, much more when it's a patient going to a place for care, choosing from the provider directory. Every doctor will have the same number of stars against themselves. And without somebody to say, this is the one that I'd go to, this is the right doctor, the outcomes are going to be less good than they should be. And Grand Rounds had figured out that that within any organization we can draw the histogram of doctors and point out the ones that perform better on average every single time, and for which things they're good, and then tell patients that so they can go to the right doctors. And when you do that, you save a lot of money, but more importantly, you save a tremendous amount of morbidity and mortality and suffering and anxiety, and nobody gives you that map. And Grand Rounds has done that better than any, I think, group in America. But there's this tension of then what do you add to it, and how would you add to it? And so I find myself often falling back to saying, wait a minute, have we helped everybody we can get the right care? Because that's where most of the ROI is. And our customers, unfortunately, sometimes, want a lot of other stuff. And so I feel like a lot of our conversations are me pulling us back to that and putting some tension on the rope between where the company can go and build and the sort of clinical moment between a doctor and a patient. And our most spirited recent conversations are around the notion of like, what is clinical navigation versus navigation, and what do we want to do? So maybe you should comment like what that's like and what your perspective is.
Well, I love the focus on clinical, because the interesting thing, Matthew, to your point, and kind of this whole panel is, we're all thinking about healthcare here, and I bet you if I took a core sample, like a 5-minute chunk of recorded conversation from the board meetings that most of us have, we're not actually talking about the moment between a doctor and a patient where healthcare happens. We're talking about the interface, the EMR, the stuff you were just talking about. We're talking about payment. We're talking about risk. All of these things matter. But really, when you ask patients and providers what they want, is they want that crystal clear, awesome moment where they can solve a problem. And this could sound like motherhood and apple pie, but I'll be honest with you, some of the best conversations we've had in the board meeting, including the conversation that led to Summit, was how do we get more people to pick that moment correctly? What do we need to do? Because expert opinions, our original founding product, wonderful way to do it, doing really well, covering 3.5 million lives. But we needed to find a way to do that for more people without losing our edge and without losing what made us special in the first place, which was we really wanted to facilitate that amazing interaction. And that was a push that Bob had in those board meetings, because we have other investors, other really awesome technology investors, and they want to talk about kind of some of those other things sometimes. It's great, and those are good conversations, but you got to bring it back.
And part of the tension is it smart to actually lower your net promoter score, but be clear to patients about, we think you're going to make a wrong choice here. Like going to that dermatologist, you're going to get a Mohs surgery you don't need that's going to hurt.
Yeah.
You should do something different. And how do you design the product to actually optimize on quality versus NPS versus engagement versus other things? And that's like a healthy trade-off that you need to have. And I feel like often I'm the one saying, wait, like don't let that happen. And then we have a good discussion.
Are there other MDs on the board? How specific is this? Because you have, you're a tech guy who met the super smart doctor. Okay.
Yeah.
The Harvard government stuff.
Although
is all good,
I did have like one of the most
that.
senior people at Memorial Sloan Kettering last night go for like 10 minutes of conversation with me, being like, where, by the way, remind me where you did your residency? He was asking me this question. Residency at eBay and PayPal. Yes, we do. So Bob is, of course, an MD and did one of the kind of finer oncology trainings in the United States. And then my co-founder is still the chief of interventional radiology at Stanford. That is his full-time job. And so he kind of brings expertise and voice to it too. I think my biggest point of personal pride actually is now they both use the service when their family members need help. And so that's, because we started with the whole idea, if you had a doctor in the family, who would that person call or otherwise network you to? And so a kind of small milestone of success is having these two guys who I deeply respect, rely on us to do that for them.
So let's talk a bit about, I asked them earlier, can you find a time when you disagreed? And they actually, you came back and said, well, we didn't disagree, but there was another time. So let's talk a bit about those times when you're talking about strategic decisions in the boardroom and there are these different interests. Give me an example about a way that, something that happened and how did you get through it and how do you work together around that?
Yeah, I mean, so I'll give you one that's super fresh. And I'd love to get your perspective because honestly, we haven't even really totally bottomed out on this.
Do it live.
Let's do it right now, live.
Do it right
So
It's like the cabinet meeting yesterday.
Yeah.
On TV. Let's negotiate. Okay.
Yeah.
We'll make more progress.
Yeah, exactly. I hope. So we just finalized our 2018 plan for the company, and like many companies, I'm sure in this audience, we have a whole bunch of kind of non-financial goals, which are leading indicators of success and health of the company. And Bob really wanted to have ROI per case as one of those leading indicators. The theory being, it's good to help people connect with higher quality healthcare, but if you can't prove time and time again that you're actually driving overall ROI to the employer, you might find yourself in a tough place. And there was a vigorous debate on it, not because it wasn't important. We all understand it to be important. And by the way, second opinions have been measured and show great ROI all the time. But because we felt like focusing there could create tension with the member experience stuff that we were trying to do that we thought was going to be so critical for the future. And so there was a big back and forth. And actually, I don't know that the board has completely landed that airplane. But what's interesting, and this is what's so important, is that I think without Bob's experience, not just as a doctor, but in the payer segment and thinking about how providers think about this, we probably wouldn't even had that conversation. It would have kind of slipped under the rug in a way that could be dangerous as we think about the next 5 to 10 years. We've lived in this kind of low inflationary environment. We're probably all anticipating higher and higher costs. We should be talking about this.
And my push on this is that we can do many things, but if we aren't making sure that the patients that we're working with, that most of the time we're meaningfully changing the healthcare that they get in ways that we believe makes it higher quality and lower cost for whoever's paying for it, that are either necessity or our price or our position, our privileged position would change. And on the one hand, we can say, well, it's good, so let's focus on other things this year. My push has been, we can always make that better. Because when you're sure that you're helping more people who need more help and driving up the ROI and getting to the sickest part of the population, you are indispensable. Yeah. And so that's the tension set. But back to my comment earlier, there's tension on NPS and engagement too. You know, we want to help everybody, and so you don't want to just focus on a narrower segment. You need to get the voice right on how you recommend things to people so they trust you versus think that you're acting in some other way. And so it's complicated, and we've had lots of debate about this and many emails, phone calls about it. And I have no doubt the company cares about it, but we had a big debate about should that be one of the 3 or 4 things that we're going to make matter most.
And the problem in navigation is, because we're doing this, the problem in navigation is you've got to get people to trust you as a place to go, and not just go for the pancreatic cancer, but for all of their healthcare needs. And you have to show a through line on what that experience can be, what you'll do for them every time, the way you'll follow up. And so you have to prize that member experience, because that's the thing that actually hasn't happened across any of these platforms that allows one place to become the centerpiece of the healthcare journey. And so that's why I worry and continue to worry that if you focus on ROI, you might make some business decisions that could compromise that experience.
Exactly. Yeah.
So I want to switch gears a little bit to the relationship. Bob, I understand that you've been hanging out with the Park brothers a lot in West Virginia and other places. Just say non-grounds rounds what you're doing there. Just say a bit about that organization. I mean, you're starting something, a health plan is even more ambitious with those two troublemakers. Tell me a bit about what you're doing there, and then how does that relate to the time you can spend with your later stage companies? Just explain a bit about how that works for you.
So a little bit like Brian, I feel so blessed that I have a job where I spend my time with people like Owen and people like Todd Park and people like Puneet, and have the privilege of having them ask me for help. And there's nothing that gives me more joy except for my children than helping our companies be as successful as they can, because all of them together, I think, make healthcare better faster. And that's what gets me out of bed, is to help hopefully all of us hopefully have a healthcare experience that sucks less than it does today, that has like the navigation that Owen described, with the right clinician, with the right information. Like that's what makes me happy. And do it with people that will do it with like speed and awesomeness. And so Todd Park and Ed Park are two extraordinary people who are now dedicating their lives to redesigning care for frail, vulnerable senior citizens. I met Todd Park at the White House. Actually, during the transition before the White House, he was working on the HHS transition team, and there was this guy who was bouncing in the corner, not like any of the others in the room, named Todd Park, who was like a flight of ideas, most of them good, about how we can change everything in technology and healthcare, and he was compelling. And so when I went into government, my job was to make him come in, and so for the next 60 days, I called him every day and said, "We'd like you to come into the government." And he's like, no. Eventually, the president called him, and he said yes. He's much more, he's a better closer.
He has more persuasion power.
A lot more, yeah. I'd say another league. And so Todd came in, and then we worked together a bunch, and we started a bunch of initiatives, such as the Health Data Initiative, where I met Matt. And then when I left government, I was out having lunch with Todd at the American Indian Museum. We were having burritos, because he always orders what you order. That's how Todd orders. And I'm like, what should I do? And he's like, you should go to healthcare venture capital. It never occurred to me, never met a venture capitalist, nor did I know what one was. And he's like, introduced me to Brian, and came here. When Todd left the administration, after 7 years, longer than any of us survived. He came back and we began brainstorming, just as Brian talked about with me, about what to do. And the interest that he has is not dissimilar to what Owen's interested in, which is how do you make the doctor-patient moment of care better? And the thesis of Todd and Ed and now a company called Devoted Health is that you need to start by actually paying the doctors differently such that they have incentives to care about the complication avoidance, to go to your house, to call you, to be that like Dr. Welby style person with technology and things. And to do that, you have to actually become a health plan. So we're going to become an insurance company and launch in a handful of states in South Florida with a bunch of primary care partners. And interestingly, it's a company really rooted in the same observations of Grand Rounds, which is doctors are great at some things, but not everything. And so matching patients to the right doctors for the right thing is really important. Having second opinions, even when they're at the right places with doctors and what they're doing, is really important. Navigation for everything is really important, because if you send them down the wrong branch of the tree, a bunch of stuff happens. And so Devoted Health is going to try to build technology and services that wrap around great primary care doctors to help them do kind of this modern self-actualized care I described for people that are frail and old. So
I'm trying to get off two things together and hopefully get one answer out of both of you here. So you also went with Fateh Mostashari at...
Aledade.
Sorry, I was going to go... I keep on calling it Gale, but it's Aledade.
Aledade.
Thank you. I saw last night. Again, same thing. It's a big impact idea. Can you arrange doctors to do things differently? Owen's is a big idea. Owen, you mentioned that Venrock likes high capital, high impact ideas.
We prefer capital efficient high impact.
Okay. We'll discuss how. Again, you've then got that tension, right? So now a lot of money has gone into Grand Rounds. At some point, then we can talk a bit about Castlight, which you were on the board of before you joined Venrock. At some point, something has to happen next, right? For the other, maybe you guys at Venrock don't care, but the other investors care. So how does that conversation start about the ugly money side of this? You're making a big impact, you're doing well, you're growing, but what happens next, and it's been a few years now. How does that work in your board?
Bob's going to have to answer that real question, because it has never happened at the Grand Rounds board meeting. Because Rusty and I said, and we believe today, that we wanted to make a healthcare company that was going to impact over a span of time measured in decades. And so there will be times when we have to return capital to our investors. Fortunately, we're in a position where we are performing, and it seems reasonably assured that we will do that, and do that in a way that everybody will be appreciative of. But implied in your question, I think, is a different challenge for us, which is that we look out at digital health generally, and we feel blessed and fortunate we're going to continue to work like dogs to make sure that we deliver against the experience that we sell through our product. But we're also a company that is one of only a few companies that's actually made it out of that phase, that early phase. I remember the first time I was here, we were near where Puni was, and he will get there, but there aren't a lot of companies that actually have made it out of this digital health maelstrom. And in some ways, we have to stand up for everybody else I don't take this as my personal charter, but we have to kind of defend the amount of dollars that have gone into digital health, which have been disproportionate to the returns in digital health. So hasn't happened yet.
Yeah, it's never happened actually in any of the board meetings that Brian and I are in that we think about financing as fuel for helping the companies grow, acknowledging that at some point, hopefully, we get our money back. But it's all about growing big, lasting companies, and the longer you can have that mindset, the bigger these things tend to get. And the longer term thinking that you lead to better strategies. And so we are much more anxious about growing large companies that will have large multiples at the end, as opposed to focusing on IRR. And so that makes us have a much longer term view. And then the question is, how do you get the capital? Do you use debt? Do you use public markets? Do you do private markets? And that's a question of what kind of capital you need, what kind of partner you want, what kind of time frame you have for it. And we think a lot about it that way.
Yeah, and my conclusion to the first two conversations and all the time I spent with you, Bob, and Brian, and several others, is that you're making these big bets, and I was kind of kidding with a certain venture capitalist who I won't name, from a very famous venture capital company, about you suggesting how people could work better with providers and work better with players, and how they have to do all these things. And I said, It sounds to me like you're suggesting that Jeff Bezos would show up to meet with John Doerr and explain how he was going to help Barnes & Noble do a better online service, and that's not really what you're trying to do. You're trying to figure out how's the category buster and how can we change the whole thing. So I think it's great to hear you have that long-term vision, and long may it go on. And I personally love Grand Rounds and love the work Owen, Bob, Rusty are all doing, because anybody knows if you go into the healthcare system, whether we find it's navigation, clinical navigation, or whatever the hell you call it, people get stuck, lost, bad things happen, and it's an experience that sucks. So please help us stop sucking. Yeah. And with that, I want to say thanks a lot, Owen, and thanks to Bob.
Thank you, Matt. Thank you.